name's Jane Tiller, and I am a global head of clinical development for neuroscience at Johnson and Johnson. If you look at our some of our studies, we found that about 70% of people actually had metabolic risk factors. Obviously, a lot of us in the US population have metabolic risk factors, whether that's insulin resistance or being overweight or into obesity. But we do know that particularly people with MGD and insomnia symptoms have increased cardiovascular risk. And then if you have the metabolic symptoms, then obviously that's not a good thing. And we don't want a treatment that would aggravate that. Ideally, we'd like a treatment that would help with that. But what we were looking at with Seltorexant, and it was a post hoc analysis, was looking at those patients who did have metabolic risk factors, whether that was insulin insensitivity, obesity, or raised blood glucose. And we did see this trend to improvement there and definitely less weight gain than we saw with quetiapine. So, that is obviously a good thing and what we would like to see for patients. We know, because it's sort of part of diagnostic classification, that sleep disturbance is very, very common in major depressive disorder. About 80% of people have sleep disturbance. And we also know that it's associated with increased risk of relapse. We saw that in the STAR-D data, for instance, and other adverse outcomes. So getting treatment, not just of the depressive symptoms, but also the insomnia symptoms, it is important. And we think that because of Seltorexant's unique mechanism of action, it's actually getting at a core causal psychopathology that could be driving both low mood and sleep disturbance. So we're sort of excited about that, the potential of bringing a new mechanism that will help patients. We also know that for those patients who have had a partial response, often insomnia symptoms persist, and they are associated with more healthcare utilization and more difficulties with sort of normal functioning and employment as well. So again, very important things that if we can help with Seltorexant, that would be something we'd be very excited about.